Welcome to Couples Therapy in 7 Words. I am your co-host, Judy Alexander, and I'm here with my husband, Dr. Bruce Chalmer.
Hello, Judy. Hello, viewers and listeners. Here we are in episode number 101. We just did 100 last time. And our topic for today is?
Sex Across Differences, an interview with Emerald Aueyong.
And we had a lovely interview with Emerald, and you will get to see it shortly. She is a therapist out in Los Angeles, a sex therapist out in Los Angeles. Really neat stuff. And you know, is this going to sound weird and old fogyish of me to say? Yes, probably, but I'll say it anyway.
Go ahead.
I just enjoyed the fact that she's young in her career. And that's neat to get a, you know.
Yes.
I just enjoy it as an old guy in the career. I enjoy seeing folks who are newer in the career. She's very knowledgeable and seems very competent.
Passionate.
And very passionate, and just really enjoyed that.
Great.
And so it's great. That's just added to it.
Yeah, so stick around.
Stick around and enjoy that.
But before...
Yes. We have some things to tell you about. I want to lead with my newsletter, folks. I have a newsletter that I've started. It's already had a couple of issues that are out. When you sign up for my newsletter, which you can do, by the way, from the website you see above my head if you're watching this, and if you're not watching it, it's ctn7.com, number 7, ctn7.com. Or you can go to brucechalmer.com. Either one of those work. You can sign up. You can look for the box that will materialize before your very eyes that says, click here to sign up for Dr. Chalmer's newsletter. And when you do that, you will have access to the archive as well, so you can read numbers 1 and 2, because you don't want to miss those.
No, of course not.
It's just fun stuff. I really am having a lot of fun putting together the newsletter, and it's interactive in the sense that I'm asking for, you know, feedback, and I've already received some, and, you know, already have a question out there that was posted by a reader, and soliciting, responses to that. So please do that. And also, while you're at ctn7.com, which is, by the way, how you can get access to all of our previous 100 episodes, as well as this one. This one you must already have access to, or you wouldn't be watching it now, would you?
That's right.
You can get access to our merch. We have our merchandise. We're holding up, for those of you not watching this, we're holding up our beautiful Couples Therapy in 7 Words mugs in the 15 and 11 ounce sizes.
Be kind, don't panic, and have faith on one side, and our beautiful Couples Therapy in 7 Words logo on the other side. And merch also available in t-shirts, tote bags. I think that's it.
That's it. And well, we also have, actually, this nice segue to talking about my new book. Because I also, while I was at it, it's easy to design these things, folks. The companies that do this make it easy. I have a t-shirt and a tote bag where what it has on one side is the cover of my new book.
That's right.
Which is, the title of which is?
It's Not About Communication, Why Everything You Know About Couples Therapy is Wrong.
And the cover is worth looking at, folks. When you see this, I will. I don't have a book, a paperback book in my hand to hold to show up, but I will put this on the screen. But for those of you not watching this, it's worth going to brucechalmer.com just to check out what that book cover looks like. It's really kind of cool.
It is a work of art.
It's sort of like a Liechtenstein-esque picture. And we were pleased with what the designers came up with. It was actually Judy's idea, of course. It was a wonderful
by Judy,
idea.
Not designed by me, though.
Designed by our designers. But,
designed by an artist.
By the professionals. But we were really pleased with it. So do check that out as well. And get a hold of the book. All of the versions are now available. By the time you're seeing this, well, as of now, as we're doing this, the Kindle version's out, the paperback is available, and the audiobook is available, and all those things. If you go to ctn7.com, there's a books tab, or go to brucechalmer.com, you will see all the information about that as well. And one more thing to say before we get to our interview, which is please rate this podcast, tell your friends about this podcast, and get the word out. Rate us and like us and all that kind of stuff.
Follow us and all that stuff.
I think that's what we need to say at this point.
Okay, so enjoy the interview, and we'll see you on the other side. Our guest today is Emerald Aueyong. Emerald is a sex and relationships therapist at Togetherness Therapy, a private practice based in West Los Angeles. She specializes in interabled and interracial relationships, desire discrepancy, sexual trauma, and dating. Emerald has 3 years of experience working with working with the substance use disorder population and previously incarcerated individuals, and nearly 10 years of experience working with individuals with disabilities. She believes that sex and mental health topics should not be considered taboo and instead should be embraced as part of the human experience. Emerald, welcome to Couples Therapy in 7 Words.
Thank you so much, Judy and Bruce, for the introduction, and thank you for having me here.
Oh, we're delighted to have you. So could you tell us about, your journey? How did you become a therapist and what got you into those particular specialties?
Sure. So I've always been interested in sex since, I don't know, probably like 6th grade. Just knowing that people can become more intimate at a deeper level was very interesting and intriguing. Although I didn't partake in the activities at that age. It was just an interest of mine. So I was very curious, asked a lot of questions. But coming from an Asian American background, it was kind of seen as, shameful, and that's something that you don't talk about. And I always wondered why. So that kind of sparked my initial, intrigue for like, why is it considered taboo? And maybe it shouldn't be considered taboo because, we're human, right? We should be able to experience, and we should actually embrace that we could experience the spectrum of emotions and intimacy with other humans as well. So when I started my master's degree in counseling, I started to venture out and see what other areas I could go into. So partially, higher education, clinical counseling, career counseling. So all of those were very interesting, but I stumbled upon sex therapy. And, back in high school, when I took my first psychology class, I thought it was very interesting that psychology was a thing. I didn't know what psychology was. I never knew what a counselor was. I thought there was stigma around mental health, and it was just lack of awareness pretty much.
Yeah,
so
a lot of people have that thought.
Exactly. Yeah. And so when I learned that, I could become a counselor and then also specialize in sex therapy, I made that my entire goal throughout my entire undergraduate education. But
Well,
I did also,
even as an undergrad, you were thinking that.
Yeah, as an undergrad,
Wow.
I was considering counseling, but I was also trying to think about my career trajectory and financial, stability. So I was looking into speech pathology at the time as well. So I was studying speech pathology in my undergrad, and then I minored in psychology. And then when I applied for graduate school, I applied to both speech pathology and counseling. I got rejected from speech pathology. I went into counseling.
It was meant to
And
be.
it was
There you
meant to
go.
be.
Yeah.
Exactly. It was meant to be. And I couldn't be more grateful that I got rejected. It was a bittersweet feeling, of course,
Sure.
but my heart truly belongs in the mental health field. And I think, even at a young age, people would say, oh, you should be a counselor, but I didn't know what that meant. But I was like, okay, maybe, right? And so when I did get into graduate school, when I learned about sex therapy, I realized I can be this mediator for individuals within their relationships. Because I realized too, when people talk about their sex lives, it's sometimes seen as a joke, like, oh, you're having bedroom problems, or things with erectile dysfunction, like, oh, you can't get it up, right? There's like these jokes in society. And I always wonder to myself, why does it have to be a joke? It's not a joke. It's a genuine ask for help. And so I wanted to be that mediator for individuals and couples as well.
And it certainly is an integral part of any kind of deep, committed relationship.
Yeah, I would agree.
Yeah, it's interesting because when you we saw your bio that you sent us, and so you got into sex therapy, and then in particular, you're kind of going for situations, and there's always differences with couples. I'm a couples therapist, that's why they show up in my office.
Exactly.
But you're going for some interesting differences because you're talking about working with interracial couples and interabled couples, and then even something like desire discrepancy is a fascinating sort of, sometimes kind of wired in different, sometimes not. It's hard to say. It's different from the other ones. But I'm curious about any of those. So, like, what are some of the issues you bump into, like with interracial couples, different cultures, whatever? What do you deal with when you're talking about interabled couples? Just curious if you want to talk about that.
Yeah, absolutely. So, fun fact, I'm actually in an interracial relationship myself. I'm
Hmm.
Thai and my partner is Mexican.
Hmm.
And I've always dated like outside of my ethnic group. So
Hmm.
I have dated Asians, and um, there is that cultural factor that we have to understand one another, and that really emphasizes the role of compromising. But then also we have the family factors as well. So personal experience that kind of intrigued me. I'm actually also a researcher, so I'm part of a research lab at Cal State LA,
Ah,
under Dr. Wu. And so one of the first projects that she opened up for us to choose from was interracial relationships comparing with intraracial relationships and their milestones.
Mm-hmm.
So um, I was like, absolutely, I want to be on that project. And so from there, it kind of was like a snowball effect of, okay, now I'm doing research in this. I'm better understanding these milestones between these two groups. And then I thought to myself, well, there's not many therapists or sex therapists who really specialize in interracial relationships. So that's where I was like, okay, that's actually really interesting. I find it interesting, and I think there's a lot of help that's needed. I tend to gravitate towards populations where like resources are needed most, or there's really a lack of understanding or awareness.
Mm-hmm.
hmm.
So that's really where I tend to gravitate toward, which is the interabled population as well. Um,
Yeah.
yeah, considering individuals with disabilities don't get as many or as much resources, if any, in regard to their sex lives,
Yeah.
because people assume that they're not having sex, but they are.
Yeah.
Hmm.
So is that the biggest misconception about um, people with disabilities, or what are some of the misconceptions that you've come across?
Yeah. So some of them would be that perhaps they're asexual, where they don't feel or want to have sex.
Mm-hmm.
I did a literature review on women with spinal cord injury and sexual barriers or their sexuality. Sexuality being that it's the entire everything to do with sex. So like your emotions around sex, your views on sex, not just your sexual identity, right? So it really encompasses the whole thing. And I found that the participants in various studies expressed feeling as if society feels they were asexual, they didn't have sexual desire. Um, People didn't know how to approach dating someone with a disability because maybe they don't want to offend, or they just think, okay, well, if you think of the sex positions, then it just won't work. But the thing is, I think maybe lack of open-mindedness is probably one of
Mm-hmm.
the bigger areas here, like bigger problems, is that you can still have sex even if you don't feel sensation. And yes, perhaps one partner will need to be more active than the other. If you have to move the body, move to different positions, but it's really up to compromise. So I think one of the primary misconceptions is that they aren't engaging in sexual intercourse, or they're not engaging in intimacy or dating at all.
Yeah.
Mm-hmm.
So if we make that assumption, we're not giving the resources because we're assuming, right?
Hmm.
So I found that that's probably one of the bigger issues.
Yeah. I think you had mentioned you saw the interview we did with Regina Kep,
Yes.
and
Yeah,
who works a lot with that. And I was fascinated with, I don't know if she specializes, I think, a lot with older folks. So
exactly. Yeah.
there's a lot of dementia stuff going on. And I was just fascinated with all of the ethics around that issue of how
Mm.
do you manage um, helping someone have access to sexual activity when you're trying to figure out what does consent mean when somebody has dementia. And
Hmm.
it can be because the a simple position would simply be to say, well, they can't consent because they're demented, except that deprives them then of any possibility of sexuality. So
Right.
I don't know if, again, I think that's probably outside your main population, but I'm curious if you've thought about that, or how that applies even in cases where it isn't about dementia, where consent can be clear, but then
Yeah.
maybe people need assistance, and how do you manage that?
Yeah, exactly. I did watch the podcast, and a lot of thoughts came up for me because I realized, wait, that's a really good question, because I didn't even think about the idea of consent when it
Mhm.
came down to individuals with dementia, right?
Yeah.
When it comes down to physical disabilities or even neurodiverse individuals, which is who I am serving now,
Mhm.
individuals maybe with like ADHD and autism, so people on the spectrum. And I think that actually is related to your question here about consent as well. Um, I think that's it's. I'm thinking back to your previous podcast with Dr. Regina Coop, and I think what she was saying about uh, sorry, I'm getting my thoughts here.
Okay.
What she was saying about capacity
Mm-hmm.
and understanding, like, this is my partner versus this is my sexual partner. I think probably similar rules apply here.
Ah,
Because if someone with autism, for example, doesn't understand the concept of sex and someone either like coerces them or like manipulates them into it, and that's not consensual.
yeah.
So that's why, though, I think education and awareness is very integral here,
Mm-hmm.
because if we can help individuals with autism or other neurodiversities, and maybe physical disabilities as well, if we can give them the information, give them the education, then they can make those decisions themselves.
Mm-hmm.
Now we can't change other people's behaviors, unfortunately, in terms of like the people who have a have an alternative agenda, right? Like malintent. But we can equip our neurodiverse individuals with the tools and the understanding to make those decisions for themselves. So I think communication is probably the biggest thing.
Yeah.
I don't know if that answered your question.
It does. What I just thought of when you were talking about that, especially folks, neurodiverse folks, we had a friend. I know very little about Williams syndrome. I don't know if you've heard of it. The only
I
thing
don't
I know
think so.
about Williams syndrome is through this friend, and then I saw something on 60 Minutes or something
Mhm.
like that about it. And it's a fascinating issue because folks with Williams syndrome are too trusting. In other words, they are so friendly,
Mm.
and they're known to be just incredibly friendly, and
Mhm.
to a fault, of course, because they will not detect when somebody has a bad agenda toward them.
Yeah.
And so it is a really tricky business. How would again, I don't know enough about it.
Mhm.
You're just stimulating my curiosity. It's sort of like, gee, how do you
Yeah.
manage that for someone who is dealing with
Right.
that?
Well, I'm,
Yeah.
making me think because it never occurred to me. And of course, people with autism probably do have sex, but that it just, because we've never dealt with anybody or talked to anybody that's dealt with that population, it's very intriguing. So what are the issues that somebody with autism, as opposed to like non-neurodivergent? I'm not up on all the latest terms, so excuse me
No
if
worries.
I speak out of turn. So how do you address those issues with somebody who's got Asperger's or autism, or and might not even be aware of sex or how to have a relationship with the partner?
Mm. Can you elaborate on what you mean a little bit by um, how would we
Like,
approach, like, if they're already seeing me, or are you meaning like
so when
at like
somebody
what
comes
age?
to see you, let's say you've got somebody who's on the spectrum, on the autism
Sure.
spectrum, and I maybe their partner is or isn't,
Hmm.
but they're having some difficulties because they don't know how to communicate about sexual issues. You
Gotcha.
come
Okay,
across
thank you.
that? Have you come across that?
Yes, actually. But I think the thing about couples therapy, which is kind of cool, is regardless if someone has a disability or not, a lot of the topics or the issues that I see pop up are quite similar. So they tend to overlap. So I
Mhm.
think
That
not
makes
just with,
sense to me. Yeah. Yeah.
yeah, right?
Mhm.
So I think we're like, to your question though, um, and this applies to other couples that I see as well, is communication. So just how can we teach these individuals to communicate? But first, do we understand what the goal is? Do they
Mhm.
understand what the goal is? Do they want to express any sort of desire? Do they want to engage in intercourse in the first place? But first, let's understand, like, what is intercourse?
Mhm.
What does it mean to be intimate and passionate um, with someone, or sexual with someone, right? And then finding out if that is what they indeed want to do. If we all deem, yep, that is what I want to do, I just don't know how to communicate that, I just don't know how to go about that, then we can talk about really the expression of it, right? Using I statements, for example, using setting up the space for it, like, hey, telling your partner, I have something important to talk to you about. it's not bad. It's just I have a really hard
Yeah.
time communicating.
It's skill building at that point, in a sense.
But yes,
It's
exactly. Thank
funny.
you.
I don't know if you're aware, Emerald, but the last book I wrote is called "It's Not About Communication," and the whole thesis. But it's interesting because this is the exception, and I
That's
write about
right.
it in the book. The whole
Oh,
thesis of the book is, in general, unless you're on the spectrum, or unless you have some specific disabilities, we're actually very we're very effective at communicating what's going on, whether we know it or not. You know, and you can dress up contempt in I statements and it's still contempt, you know? The exception that I talk about in the book is, except for folks on the spectrum, which the specific issue there often, as you
It is
know
about
better than I, it is
communication.
about communication. It is often about not knowing how to understand how someone is hearing you and how to read those cues. Again, you know, I'm sure
right.
you know more about this than I do because it's not a specialty of mine. But that sense of that's where it is about communication. And often I was sort of nodding when you said about it's really, there's a lot of similarities even for folks who are not on the spectrum, because
Exactly.
again, I would say, well, it's not about teaching communication there, but it is about making it so that they don't freak out at certain topics.
Yeah.
And then they can talk about it. Then they can actually communicate if they're not in freak out mode. So a lot
Yeah,
of the work is
exactly.
about, yeah, go ahead.
Oh no, sorry. I was just saying exactly. Yeah.
Yeah. That's it is interesting. Yeah.
Yeah.
I wanted to ask also about one other thing you mentioned is sort of one of the things you work with a lot, which comes up a lot in my practice as well. Although again, I'm not a sex therapist per se, but desire discrepancy is it's a biggie, you know. And of course, it's funny, you may not know this. I mentioned it to the clients I work with. Before I was a psychologist, I was a statistician. That was my first master's
Oh,
degree was in my only master's degree was in statistics. Then I got a PhD
yeah.
in psych, and then I moved over to the clinical side. So that my old statistician in me says, yeah, there are no two human beings. If it's a continuum, there are no two human beings who are exactly matched in their desire. You know what I mean? I mean, and the phenomenon that one or the other person is apt to have a desire to have some kind of sexual activity more often than the other is the rule, not the exception. Do you know what I mean? And then it's a question of how big the difference is and how graceful they are about managing it. But I'm curious, do you have any favorite ways of, you know, what do you talk to couples about when that comes up? Or do you have any favorite ways of thinking about it or, you know, modeling it?
Yeah, no, absolutely. Great question. Also, I think it's really cool that you were a statistician before. It's because
Oh,
I
yeah.
think that that helps complement your work now as well, being able to understand the stats behind these things. And also, humans are very complex, right? To say the least. So, when it comes down to desire discrepancy, like you said, I think I would agree that there's no two human beings who are exactly the same. And even then, I'm not sure if that would be the best thing in couples as
Yeah.
either.
Right.
Because there's such thing as responsive and spontaneous desire. And I got this from Dr. Emily Nagoski's Come As You Are book. I'm not sure if you've heard of it.
I have heard of it.
Um,
Absolutely. Yeah.
yeah, so I would recommend that to pretty much all my clients, especially when they are interested in female sexuality. But Dr. Nagoski discusses how there's spontaneous and responsive desire. I'm sorry, wait, was it Dr. Nagoski? Did you read the book?
I didn't read the book. I've read about the book.
Okay, okay. I
And,
think I might. Okay, sorry. There's Dr. Ian Kerner. I've been doing a lot of reading
that one I
and
don't know. So,
educating lately. So,
uh-huh.
so Dr. Ian Kerner discusses the desire discrepancy in couples. So responsive and spontaneous desire. Spontaneous meaning that you are more like anytime you can go. You can have sex anytime. Your partner comes home. All right, take your clothes off. All right, perfect. Let's go. As opposed to responsive is more like I want to know in advance. I want to let's go on a dinner date
Yeah.
first. So a little bit more of that.
And stereotypically, not to over stereotype, but that the responsive one is way more women than men. Not to say that all men are in the first category at all, or all women for that matter in the second category, but that one, that element of responsive, I certainly hear more from women than from men. Does that sound right to you?
Actually, you know what's quite interesting? I used to think that that was the stereotype as well, but
Mhm.
with the more clients I'm seeing that it's more equal, where it's sometimes the man is not the one that has less desire
Oh,
or
I've
less
seen that.
libido.
Oh yeah,
Yeah,
no, I mentioned that to folks a lot. Yeah, the phenomenon of
yeah,
the man having the lesser desire is very common. but the phenomenon of the
Spontaneous is what I
spontaneous
think.
versus responsive.
Oh, spontaneous. Oh,
Yeah,
gotcha.
that one
Yeah.
seems to be more tied to gender. So that I see
Yeah.
that more with a lot of women will say, I want him to initiate. I'm all there
Yes.
if he initiates. And then, of course, if the guy has a relatively low initiating, whatever you call that, drive or something, they have
Yeah.
a problem there because she doesn't want, in these couples I'm talking about, she doesn't want to be the one to initiate because it just doesn't feel right. And, I could pathologize that. I could say, oh, well, gee, women should learn, like it's like mansplain, I could say to women, well, women should learn to, it's okay for you. You don't have to feel bad about that. And that, that's basically baloney. First of all, the mansplaining is baloney. Like I don't have to tell the two women in this conversation, but there's also the phenomenon that it seems to me, that's not pathological. That's normal human variation.
Right.
And we ought to be able to accommodate that. And couples for whom that works well, it can, of course, I don't get to talk to them. That's the old statistician in me, by the way. I realize I don't have a random sample. You're a researcher, you'll recognize that. I have a bias sample. The only folks who ever talk to me are having problems. So I don't get to see the ones where they have those interesting differences, but they mesh well, so it's not a problem. Kind of went on about that. But yeah.
Yeah. No, that's quite interesting. I think in terms of spontaneous, I do see the sentiment that you are making actually.
Yeah.
I have seen that. Yeah. I don't think I addressed your previous question though about what I see with desire discrepancy and how we go about that.
Yes, please. Yeah, go for it.
Okay. So in terms of addressing desire discrepancy, so first, I always have clients do like new client paperwork, right, with the biography form and have them like fill out the information. And I have one question about how satisfied are you with your sex life? One being not satisfied at all, 10 being extremely satisfied. Sometimes I'll see, one has a 6 and the other is a 3. So then I would bring that up into session. Okay, why is that? And that's when we start getting into the content and like the meat of things. When we start just opening the discussion of sex and we start discussing, okay, what's really happening in the bedroom? Are we happy in the bedroom? That's when a lot of those issues of like initiation would come up. And then sometimes after initiation comes up, then we start hearing, oh, I don't really want to have sex all that much. I don't really care about it. So then when one partner is saying, no, I really want to have sex, I really want to be intimate with you, I really want to engage with you in this manner, I want you to touch me, I want to touch you. And then we have this other partner who is more like, no, I don't really care too much about it. Like, I love you, right? Like, I love you. I love that we live together. But that doesn't necessarily mean that they want to be intimate as much as the other partner. So when it comes down to desire discrepancy, it's really about compromise is what I find. And I say that a lot. Everything is about compromise, I feel like, because we're not going to make the person have sex if they don't want to have sex. And we're not going to make them initiate.
Yes.
Yeah.
Right?
Yeah.
I don't prescribe my clients to, all right, this week you're going to have sex whether you like it or not. I never say that. I always say, if you want to open it, if you want to leave Friday night open for a date night, whatever happens in that date night happens, but there's no pressure. Once you kind of can alleviate some of that pressure, it makes someone a little bit more willing, right? Maybe open to kissing, maybe instead. And it doesn't always have to lead to intercourse either. So compromise is probably the number one thing. Once we kind of crack open that case and we start discussing these topics, then we can start talking about next steps. What are some things that we can do? What is okay on your list and what is not okay on your list? Does that make sense?
Oh yeah. And you're focusing on what couples therapists tend to focus on, which is the relational aspects. I'm hearing the voice of Batsheva Marcus in my head. Do you know that name? She wrote a book, Sex Points. Batsheva Marcus.
I don't think I've heard of that one yet.
Yeah, it's I don't know if I'd call it controversial or not controversial. She has a point of view that not everyone would share, but of course that's true of anybody, I suppose. But she pointed out, one of the things I really enjoyed about her book, and we've interviewed her on our podcast actually twice, as a matter of fact. and once before her book came out and once after. And I commented on her book. I said, one of the things I really enjoyed in your book was the chapter where you warn people against people like me. Now, of course, she demurred and said, oh, no, I'm not really. But, but I enjoyed it because she was pointing out that those of us trained in couples therapy and, looking at the relationship will sometimes miss that some of this stuff is medical. It's like when she deals a lot with women who are having vaginismus and, various kinds of issues, some of which doesn't seem to be about the relationship. Sometimes that sort of thing is, but often it is not. Mm-hmm. And she happens to be the clinical director of a medical clinic for women,
women with sexual problems.
Yeah, women with sexual issues, but women's health in general.
Yes.
And she's the sex therapist there.
On sex.
Yeah.
Right.
Yeah, she's the one who focuses on that. But it's so interesting that a lot of times what they're talking about is, well, maybe you need some hormone treatment, or maybe you need some dilators, or exactly. Yeah. There's things besides just the relational. And of course, I respect that. It's like, my focus is apt to be the relational aspects, but which is where like things like compromise come up. Mm-hmm. She's saying, don't ignore the medical aspects as well.
And that sounds absolutely some things that you deal with as well, because of the nature of your being a sexual counselor as well, and not just couples and not just individuals.
Yeah, does that come up? I mean, do you sometimes referring to a gynecologist or something, or that sort of thing?
Absolutely. So I love that you bring that up too, because it's a perfect segue into one of the other specialties that I have. I'm not sure if I mentioned, but I do work with women who have painful sex as well. So which can sometimes affect desire discrepancy, but really I'm not sure then if that's desire discrepancy or just they don't want to have sex because of the pain, right? There's a difference there.
Well, it feeds off each other.
Yeah,
exactly. So when it comes down to if anyone comes to me and says I'm experiencing painful sex, I've seen gynecologists, I've seen my PCP, my general doctor, they can't find out what it is, I would typically recommend refer them to a pelvic floor physical therapist. Have you heard of this before?
I guess that. Yes, absolutely. Yeah.
So I guess for the listeners that aren't quite aware, the pelvic floor is pretty much everything from your tailbone, like your butt area, so the tailbone, up into the front. So like, when they say like right back to front or front to back, right? So it's really just everything holding the abdominals and everything there. And so the pelvic floor physical therapist will help diagnose actually and assess where the pain might be coming from. Is it more of the outer? Is it more of the once after you insert? Is it the initial or the after you go in? Where is the pain coming from? And then they'll be able to diagnose, is it vaginismus, vulvodynia, like what is happening? Because then once you understand the diagnosis, then we can start with the treatment. And again, I'm not a medical doctor, right? So I'm going to leave that to the medical doctors and the physical therapists. But seeing a pelvic floor PT for these people have specialized in the pelvic floor and understanding, okay, you need some more strength in your pelvic area and abdominal area, your core, so that when you do engage in penetration, it's not as painful. Or perhaps taking it away entirely. Yeah, go ahead.
Yeah, well, there's something Batsheva points out that, you mentioned that, you need to find like a PT who specializes in pelvic floor work.
Yeah.
And she also mentions there are a lot of PCPs, and I say this with respect for our medical colleagues, but there's a lot of PCPs and a lot of gynecologists even who have astonishingly little knowledge of sex.
Exactly.
Because they're not trained that much in medical school.
Yeah.
And so even to find a gynecologist, say, who knows about that stuff and can actually work with you on that stuff Batsheva talks about that quite a lot.
Right. That's really amazing. And you sparked my thought into talking about rehabilitation counselors too, because what I found in my graduate program and a lot of other graduate programs, we don't talk about sex and disabilities, which is why I did one of my projects on that very topic, because there was a lack of. And just backing up what you were saying about how doctors aren't trained in discussing sex all that much or even incorporating it, I do think there is a need for even incorporating it more in the rehabilitation counseling discussions too.
Yeah.
right?
Yeah.
As a rehab counselor, we want to understand what's happening with the sex part, what's happening with the dating, right? And if we
Yeah.
don't bring it up, it's hard for clients to bring it up themselves. So
Yes.
that's why the sex therapist, it's very integral that I create this safe, comfortable space for them to be able to bring it up. And if they don't, I'm going to be the one that's going to beg the question.
Yeah.
And if they don't want
Absolutely.
to answer, they don't need to. But yeah, that's what I wanted to say. That
Yeah.
that kind of sparked my thought there.
This might be a great time to segue to our
I think
listener
so.
question. We have a listener question for you, as you've seen in some of our other podcasts. We usually have we dig one up that will fit the person.
Nice.
So this is a different topic than, well, we skirted around it, but you'll see where it's at and go for it.
Okay, so Jordan writes, Dear Bruce and Judy, first I want to say I enjoy your podcast very much. I never thought I'd be writing, but here I am.
Well, thank you, Jordan.
Thank you,
Oh.
Jordan.
Yes.
I'm a 38-year-old man and never been married. I started dating Callie about 3 months ago. We're starting to get serious about each other, but we haven't slept together. Neither of us has a lot of experience, but that's not why I'm writing. I don't really have any sexual desire. In college, I fooled around with women and I didn't feel particularly aroused. I thought maybe I was gay. So I tried fooling around with some guys, but there was nothing there either. I just don't think I have any physical attraction to either sex, nor do I feel any sexual desire. I masturbate, although pretty infrequently. I don't know how to bring this up with Callie. She's the first person I met whose company I really enjoy. I do want to have a life partner, but I'm afraid my lack of libido will turn her away. Could you tell me how I should break the news to her?
That's a very great question. Well, thank you, Jordan, for bringing this up as well.
Mhm.
I think this is a common issue or dilemma that people face, and it's hard to bring it up. I want to first say that your feelings are valid, Jordan, right? And it's valid in that, like, potentially, maybe it could be a deal breaker for some people. I like to think sometimes dating is like a compatibility. So I really go based on like having financial compatibility, emotional, mental, intellectual, and sexual being one of them as well. Some people genuinely need that as well. Now, asexuality is a spectrum. I want to make that very clear. Asexuality is a spectrum in that maybe you can be, there's gray sexual as one. There's like asexuality where you don't enjoy being touched. You're not really into the whole touching thing either. But if your partner really wants it, you're down to do it maybe once every 2 weeks, where you will give them a hand job, for example, or I'm not sure if my language is okay here. Like this
Totally.
Language is fine.
We figure we're kind of PG or maybe PG-13. In other words, when I said baloney rather than BS, although I've said bullshit before,
okay.
I just said it. So
Okay.
we skirt the edge. But
Well, we're talking about sex, so
we're
you
talking
may be
about
able
sex.
to talk
You
about
can talk about
topics.
sex. Yeah, you can say hand
Okay.
job. Yes.
Okay,
So,
perfect. Thank
You
you.
can say hand job, you could say blow job, you can say fellatio, whatever you want to say.
Great. And then yes, so then also I was just about to say performing oral on your partner. So
Mhm.
there again, going back to the idea of compromise, there are ways to compromise with your partner. But your question was, how can I bring this up to my partner? Right.
Mhm.
I find that I find that knowing what it is you want to say is going to be very important and probably the first step. Because sometimes when we go to our partner, we don't know what we want to say, then it becomes like more confusing for both ourselves and our partner.
Yeah.
So first understand like, okay, is this really what's happening? But if you already know this is what's happening, right? You don't masturbate all that much. You don't really have much of an interest in sex. Completely okay. There are couples who one partner is asexual and the other isn't, and they do work it out. Though it can be challenging at times, I think, the first thing would be understanding and letting your partner know that. So how to communicate, one, setting the atmosphere, like setting time aside to have this intimate conversation, not like when you're watching TV, oh, I think I'm right. Like,
Oh, by the way,
yeah,
did
by the way, I forgot to tell you this.
did you pick up some cottage cheese? And incidentally, I'm asexual. You got a problem with that? Yeah.
Yeah, you know what I
Hubris,
find
yeah.
interesting though? He doesn't say if he's ever had a physical exam to see if his hormone levels. Is that something
Yeah.
that comes up with your practice at all? Do you ever recommend men or women have their hormones checked out?
That's a really great question, Judy. I have not in my
Mhm.
practice so far. However, I do see sex therapists refer to get your hormones checked, just make like a
Mhm.
physical exam,
Right.
which I think would be a good idea.
Mhm.
Absolutely, could be definitely a first step. But also, we have to we would want to consider too if they even want to change that.
Yeah, that's the interesting possibility. He doesn't sound distressed
Yeah,
himself about his lack of libido.
Right.
He's more worried about, is
exactly,
this going to mess up the relationship?
Right. Because it sounds like he
exactly.
wants to be in a marriage or a long time partnership, but some that might be a deal breaker for Callie or other women. So yeah,
Yeah,
so
potentially.
pick a nice time to do it, right? And then
Yeah. Yeah, pick a nice time to do it. And maybe first you can journal or think about what you want to say.
mhm,
And perhaps preface it too with this is how I am. This is how I've been. Like really sharing your experience, allowing our partner to understand our full experience, or in other words, our world view, how we see the world, how we perceive things, can really give our partner some insight. And I mean, Kelly seems like a very kind person. And, you know,
He didn't say
I,
much about her. It's interesting.
no, just
yeah,
that
I'm
he
not
doesn't have
quite
a
sure.
lot of experience and they're getting serious
And he likes her.
and he likes her.
Yeah, yeah,
So she must
Yeah,
like him
yeah.
too.
yeah.
Yeah. So I mean, she likes him too. That's why they're right. So I think yeah. So atmosphere, knowing what you want to say beforehand, and then from there, I really can't tell you how they're going to respond. I can never guarantee results, right? But having that open conversation will really allow these doors to open. And if
Yeah.
you both deem that perhaps you want to see a sex therapist to help with this, I would
Mhm.
say that's probably the next step is to
Mm,
find some third party support.
yeah.
And I think everyone can use a therapist, and I mean everyone, right? So getting a sex therapist I think is a specialty to
Mhm.
help with that communication, because talking about sex can be hard
Hmm.
for everyone.
I,
And then yeah, go ahead.
I've mentioned this before, and when we talked to other sex therapists, actually, I just find it amazing. This was an experience within the last year, I think it was. I was at a training for couples therapists. So it was on Zoom, so there must have been like 100 couples therapists there.
Oh
And
well,
the trainer asked, how many of you routinely ask about a couple's sex life, like in the first or second session, relatively early on? And I'm
yeah.
sitting there thinking, come on, we're couples therapists, all of us, right? And
Oh,
the result was about 35-40%. It was like under half. And many people said, no, I'll wait till they bring it up. And I'm sitting there thinking, you'll wait till they bring it up. I mean, holy cow,
yeah.
you're probably already asking about any like mental health histories. You're asking about their finances. You're asking about, how do they handle stuff with the kids? You don't ask about their sex life? Seriously?
Hmm.
Whoa. And that's a comment on us, it's a comment on the profession.
Right.
And so that,
Yeah.
indeed, when you say, you need a sex therapist to talk about sex, at least had it been a room full of sex therapists, I got to believe that in a different result.
Well, that's what Emerald said.
I would hope.
That's on her intake sheet.
Yeah, exactly.
Right.
Yeah, I would hope so, right? I would hope that sex therapists talk about bring it up. But the thing is, maybe for some sex therapists too, it's hard to bring it up as well, which is interesting because then that begs the question, well, then maybe not a different profession.
Well,
Or
you
it's
got to
like,
wonder, or, I
right.
mean, it's often based on these, I suppose whether they're culturally mediated or whatever they are, but people's ideas about what's okay to bring up. I mean, I
Right.
do recognize I will be circumspect when I'm talking with people about sex, about how explicit I'll get, kind of feel them out as I'm having the conversation.
Yeah.
I won't immediately go to talking about specific techniques until I get the sense that you're okay talking about this. Or I'll say things like,
Mm.
hey, tell me if this is more specific than you want to get, but do you do oral sex or whatever? And
Yeah.
that actually, of course, usually has the effect of relaxing everybody, and then they'll talk about anything they want.
Yeah.
But it's, I do have to be aware of that difference. It is interesting,
Yeah.
I was thinking about this particular Jordan and Callie. He doesn't say much about Callie, except as you pointed out, that either one of them have a lot of experience, and that does allow for the possibility that when he raises it with her, she might say, oh, what a relief. I keep dating these
Right.
guys that want
Yes.
to sex. I don't really want that. It's like I want to
Yes.
be close and intimate, but this sex thing I'm kind of done with,
Yeah.
And boy, wouldn't that
Exactly.
be lovely for both of them? So
Yeah, that would be amazing. And I think that's why clarity is so important, right? Because we don't
yeah,
know what the other person's thinking. And I tell
yeah,
this often to my clients that although I'm a therapist, I'm not a mind reader. So please tell me
There
if
you
there's
go.
anything you want me to do, or if there's anything you want me to improve on, or if there's something you want to bring up, right? So
yeah.
yeah, I love that you bring up those points. You both bring up such great points here.
Well, on that very note, is there anything you'd like to bring up now we haven't asked you about?
Let me see. I guess there's two avenues. Either and maybe this could be for another discussion too, because it's
Hmm.
kind of a lengthy one, but um perhaps the topic of dating and online dating, or discussing how you can find a therapist in the first place.
Yeah, and both really great topics, which I think we'll have to defer just in time terms, because we could do another one. Maybe we will. But yeah, that both of those things fascinating. I have a whole section well, it's funny. I have a section in my most recent book about, how do you go about finding a therapist? And where I end up coming down with is, I don't know. It's hard, but um, it almost, I mean, I don't want to rule out all the information you get from other folks, but you kind of have to try it with someone before because the things you think would be salient may or may not be. That goes even to the gender of the therapist. It's fascinating. I've
Yeah.
had folks say, well, they'll ask me, like in a couples therapy context, they'll say, I want to do individual therapy, and occasionally, well, should I see a woman or should I see a man or whatever?
Mhm.
And it's fascinating to me because the stories I hear, it ends up mattering less than I might have guessed. Sometimes it totally
Oh,
matters.
really?
Yeah, sometimes not. Well, for example, I mean, for a gay, let's say a gay man, probably going to do better with a gay male therapist. Not
Mm-hmm.
necessarily, but
Sure.
often. But I've had gay men seek me out, cisgendered heterosexual guy, seek me out, quite knowing, they know perfectly well that I am not gay and I'm not going to have that firsthand experience. Or the same thing, I've had women seek me out because they wanted to work with a man. And I've worked with men who have sought out a woman because they wanted to work with a woman because they wanted that
Yeah.
other point of view. So you never know,
Wow.
I think it ends up mattering less than so many other variables together that you really can't predict until you try. And then the key point is you have to be, as the client, I think, therapists also, but as the client, you have to be pretty much all the time evaluating, does this seem to be helping? Realizing you have to give it
Mm.
some time, you have to give it a chance, you have to work
Right,
through
right.
issues, but it is on the client to really be responsible for that, for figuring out, gee, does this seem to be helping me or not? And
Hmm.
that's probably a more important skill than knowing how to pick the therapist in the first place, because no matter how
Mm.
you pick the therapist, you're still going to have to do that. I don't know. Does that make sense?
It's also personalities
Oh,
too.
yeah.
You could
Yeah.
be
Yeah.
like the best therapist, but if your personality doesn't mesh,
Oh, yeah.
you could say, well, I want to see a man, but if you don't have that comfort level with each other,
Oh,
right,
yeah. And
making sure
nobody's
you
the
find
best therapist for everybody.
right.
Yeah.
Exactly. Exactly. Yeah. It's funny you both I resonate with everything you're both saying. I like to say that finding a therapist is a lot like dating. So I guess the two
Absolutely.
topics can mesh together.
Mhm.
Because like you said, sometimes gender matters, for others it doesn't. I have seen that gender has been a preference sometimes. So I'll help like referrals, or individuals who say like, oh, I'm looking for a female therapist, for
Oh, yeah.
example. Um, and so, yeah, I think it really depends on what the person is looking for. Perhaps they want a different perspective, or a lot of times, unfortunately, I see maybe they have a bad experience with
Yeah.
a particular gender, and so then they want to switch genders, which is
Mm.
completely fine as well.
Oh, sure.
Um, yeah,
I
and
had
so, yeah, I'm
one
sorry.
years ago, I had a woman consult me specifically looking for a male because she wanted to process trauma she had with men. And it was the first time in
Oh,
her life. And she told me this months in. She didn't tell me this right off. She didn't even tell me that right off. Months later, she said, I really wanted to work with a man because this is the first time in my life I've ever felt safe in the presence of a man. And
oh
it was
wow.
really, as very, yeah, I sort of moved when I talk about it. She had a horrendous abuse history. And it was really, I found it very moving because, initially she had selected me to come to, and initially she could barely speak.
Wow.
And I wasn't quite sure, am I helping? But we just kind of went slow, and it ended up being really helpful for her. But
Amazing.
it was interesting that she knew what to do, that she knew that she had to process that trauma, and she was going to have to, as so often happens with trauma, you have to somehow expose yourself to the thoughts, but still be safe. And so
Right,
that's what she
right.
sought out, which I thought was amazingly wise on her part.
Yeah, absolutely. It's very courageous, I feel.
Yeah, yeah.
Yeah. Hmm. Oh, yeah, sorry. Last thing I was going to say about the finding a therapist too, like you said, personality is important, gender potentially important. I also think perhaps approaches is going to be another main thing, which I think a lot of
Yeah.
folks don't quite know about. But
Mm.
understanding where your therapist stands in terms of like what approaches do they use? Do they use more scientific evidence-based practices? Are they more about like spirituality or religion? Just understanding like where they are pulling their ideologies from can be very important. And then also match too, because like you said, you could be the best therapist, but maybe it's just not a fit for someone. Maybe they
Yeah.
need someone more direct or less
Yeah.
direct or structured or right. So yeah.
Now, one of my favorite shticks, which I spend 2 chapters in the book talking about, my most recent book, is
Yeah.
the notion of ideology itself. Because indeed,
Mm.
we need to be guided by understandings, narratives, ideas. If a therapist who claims not to be guided by anything is deluding themselves, that's true. We're all guided by, and we have our
Yeah.
favorite things that we seek out. You became a sex therapist and the particular specialties you're working with because you were drawn to that, And so
Yes.
for me, I think it's true of anybody. The thing that gets in the way, I think, is when we are too ideological. And
Mm.
I know I experienced this earlier in my career. You bump into a new favorite. It just seems to be the answer to things, and it just seems to make so much sense. And then I remember, I could become, oh, narrative therapy. I love the concept of narrative therapy, and then got very doctrinaire about narrative therapy, which is hilarious. I don't know if you've ever heard of narrative therapy, but
Yes. Yes,
yes,
I've
it
heard.
is. It's all about not being doctrinaire, and yet it can be incredibly doctrinaire. You can be so ideological in its rejection of ideologies. It's hilarious.
That's funny.
So that, for me, the problem is less about what specific approach, which indeed does matter, absolutely. But
Mm-hmm.
it's less about what approach the person has and more about, are they ideological about it, or are they open? Are they idea-based rather than
Mm.
ideology-based? Because if they're
Mm.
idea-based, then they'll actually be listening to the person. Do you know what I mean?
Exactly.
They won't be saying, oh, I know what you are. You fit in this category for my favorite ideology. And that's,
Mm-hmm.
people don't, don't relate well to being boxed into categories.
Yeah.
Yeah.
That reminds me of person-centered, like being able to let the client guide because they're the idea that they're the expert as well. Is that kind
Yeah,
of what you were saying?
it,
Like
it
kind of
is,
related?
although even person-centered has its problems,
Yeah.
because it becomes ideological. Because I've experienced that one early on in my career. I remember that one, read about Carl Rogers, and the next thing I know, I'm trying to pretend I'm Carl Rogers,
Right. Right.
It didn't work. What can I
Yeah,
say?
I think we all have that
Worked for
moment.
him.
It worked for him to the extent it worked for him.
Right.
That was
Right.
fascinating.
Yeah, yeah,
But you're
yeah.
you, so you can't be Carl
Yes, indeed.
Rogers.
Right.
Yeah. Well,
Yeah,
perhaps
sorry.
another time we
Yeah.
can talk about the whole dating thing is, and online dating, which is how people do it these days.
Yeah.
Fascinating concept. But thank you so much for doing this, Emily.
Yes,
We
thank
really
you,
appreciate
Emerald.
this.
Yeah, thank you so much, Judy and Bruce. It was a pleasure speaking with you today.
Well, I hope you enjoyed that interview as much as we enjoyed interviewing Emerald.
Yes, indeed. She's really delightful, and a lot of interesting stuff. And do tell your friends about that one. Tell your friends about all of them, but this one, I think a lot of, again, I almost want to say a lot of younger folks especially would enjoy this, because she is, I think, younger than most of the folks we usually interview, and
Yeah,
that's
I think
probably worth noting. And really interesting stuff she had to say.
Yeah, very nice young lady.
Indeed. So let's put in a word for our, what got this podcast started in the first place was my previous book. Why don't you say the title of my previous book while we're at it?
Okay, so that was called Reigniting the Spark, Why Stable Relationships Lose Intimacy and How to Get It Back.
And the book that just came out very recently, within the past couple months, and that is?
It's Not About Communication, Why Everything You Know About Couples Therapy is Wrong.
Yes, and please check that out. I've got some articles out now that are going to be in some newspapers about it, which will, I think, generate some additional. I'm kind of hoping it'll generate a little bit of controversy. You know, the angle I'm stressing is that this is a book that challenges conventional wisdom. You know, when I put a subtitle like "Why Everything You Know About Couples Therapy Is Wrong," you can say, what is this guy trying to say? You know, it sounds a little bit chutzpahdik, to use the French term, or whatever that is. So in any case, yeah, please do check that out. Check out the books, tell people about the podcast, go to our website, ctn7.com, for access to all of our podcasts and to look at our merchandise that we have.
And while you're at ctn7.com, if you have a question that you would like us to address on the air, you can write to us at that website. Or if you would like to suggest a guest, or if you yourself would like to be a guest, all those things you can do at ctn7.com.
And so until next time,
remember, be kind,
don't panic,
and have faith.